Hey guys, welcome back to The Dent Life. My name is Komal, and in this video I'm going to be talking you through how to do a clinical case presentation. Now, this is something that confused me so much in third year, fourth year, fifth year. It confused me throughout dental school. I was like, I know there's this thing that you have to present at the end of dental school for finals. I know I have to do really well, but I don't know what the heck it is and how it works. And we had a lot of lectures on it, we had a lot of guidance on it, but it was still really baffling. So I thought I'd basically make a guide on how to do a clinical case presentation. You can download this guide at thedentlife.com and the link will be down below. So this isn't going to be a usual video. I'm going to have something up on the screen over here where I'm going to discuss what I can see, and this is basically the guide, and I'm just going to talk about it. So I've got it up over here, and this is what you can download on the website, and I'm literally just going to talk you through it. So what you want to do first to grab the audience attention is to have a pre-treatment and a post-treatment image. So remember, when you have a case that you think is presentable, they've got a lot going on, they need a lot of treatment, take before pictures. Take pictures, practice your photography, even on people that you think don't need that much treatment. It's good to just get your patients and practice the photography, because it's really annoying when you have a patient that you've done loads of work on and you want to take pictures and you're like, I didn't take any pictures at the beginning. It's so annoying. So definitely take pre-treatment pictures for all of your patients if you can, and then some post-treatment pictures after you finish. When I was doing my case presentation in 5th year, I didn't get to take any post-treatment pictures because of the pandemic, and I was so close to finishing the treatment. This is a patient I had from September up until March, so 6 months. He had been coming in and we'd been doing so much treatment, and I didn't get to do any post-treatment pictures live. So anyway, pre-treatment, post-treatment. Okay, so then you want to put, at the first slide, you want to put background. So you want to show the people what the hell is actually going on, like age of the patient, gender, occupation, presenting complaints. So why did they attend? So when you're talking about why the patient attended, I would always use the patient's quotes. So they'll tell you something like this example here, my denture no longer fits and it rubs my gums. They might tell you, oh, this tooth hurts over here and it's been hurting for a few days, but now it's stopped. So you're like, okay. Or they'll tell you, I started flossing and that's made my teeth wobbly. Like, sometimes patients say things to you, so you want to put their quotes in to show your assessors like you've listened to the patient and how you're managing the patient. So then you want to put the history of the patient's complaint. So your denture no longer fits. Why? In this case, the patient had an immediate denture made 4 years ago and that's become loose. So you can already start to see why things are happening. And other scenario mentioned, like, there's pain coming from this tooth, but it's not in pain today. It was in a lot of pain last week, and for days I couldn't sleep, but now I'm not in pain. So that starts to like tell you, okay, there's something going on here. Sense a bit of irreversible pulpitis turn into necrotic pulp. So stuff like that. And then you have the previous dental history. So is your patient a regular attendee? So do they attend the dentist every 3 months, 6 months, 12 months, whatever they should be doing? And most likely in these patients' cases, they should be attending every 3 to 6 months. Is their dentition heavily restored? So by that I mean, do they have a lot of work that has been done in the past? Do they have a lot of fillings, a lot of crowns, bridges, dentures, like anything? So if they have lots of it, it's going to be heavily restored. Are they anxious about receiving dental treatment? So putting this in means that you've communicated with the patient, and if they are anxious, talk about what they're anxious about, like what makes them scared of the dentist, what are their expectations about the treatment. That's my next thing. What do they expect? How do they want it to be done? Because, for example, if you have a patient that's quite anxious but they expect you to do, I don't know, completely restore their oral health when they have like loads of caries, then you're going to be like, okay, this patient's anxious, they don't want me to do any work on them, but they also expect me to restore their oral health. So then you're like, okay, anxious patient, high expectations. How do you manage this patient? So you want to talk about that as well. Okay, so the next slide is going to be the history of the patient. So it shows that you've really taken time to study this patient in depth. You've really taken time to look at the medical history, because the medical history, everything in your body links back to each other. So anything medically you have will link back to your oral cavity, like it will show up in your mouth. So for example, I've mentioned some over here, so dental conditions such as diabetes, that does relate to your mouth, because you get a high risk of periodontal disease, you get dry mouth because of the diabetes or the medications, and also you consider the medical emergencies that can happen in the dental chair, so stuff like hypoglycemia. Then also you talk about the medications that the patient's taking. Again, everything the patient uses will relate to the oral cavity. And then any allergies, these are going to relate back to the things you prescribe the patient, the kind of treatment you do for the patient. So for example, as I've mentioned, if the patient is allergic to penicillin, you're not going to prescribe them penicillin, obviously. If the patient is allergic to nickel, you're not going to make them a bridge with nickel chromium, you're going to ask for something else. Or if the patient is allergic to latex, then you're going to make sure that you're not using latex gloves, otherwise you're going to have a medical emergency. So these are all things to consider in this part. Then you have the social history, so again you link this back to the patient's oral health. So if they're a smoker, you want to know how much they smoke and how many years they've been smoking for, because that is going to impact their oral health. That's going to cause things like periodontal disease, oral cancer, staining, quite a few other things. I can't think of them off the top of my head and I haven't written them down here. That's for you guys to research by yourselves. And then also drinking, if they drink, then how many units a week do they drink? Do you need to offer this patient smoking or drinking cessation? That's also something to consider. And then the patient's occupation or hobbies, that can relate back to the dental health. For example, as I've mentioned here, if the patient plays a wind instrument, that is going to affect their teeth in some way, or if they lose their teeth, that's going to affect how they play their instrument. Other occupations, like if the patient is a builder or does heavy lifting, then they might tend to grind their teeth or clench their teeth, and that's going to impact their oral health as well. Other things include, I don't know, if the patient's a hairdresser and they might use like bobby pins in their mouth. They shouldn't do that, but they might, and that might have caused the chip in their tooth that they're complaining about. I don't know, you have to relate everything back. So that's that. Then the next slide is going to be about the examination. So here I've said make sure you report on everything, even if there's nothing abnormal detected. The reason you have to do that is because you want to show people that you've actually checked everything. So you're not just leaving stuff out because it's fine. Even if it's fine, we want to know that it's fine. And this is something you include in your notes as well. So you don't just note things down that are abnormal. You also have to say, I've checked everything and everything is fine, nothing abnormal detected, apart from this, this, and this. So extra oral examination, you want to check the TMJ. So ask the patient to open and close, move side to side, is there clicking, is there crepitus. Then you check their muscles of mastication, so get them to clench their teeth, feel around their mandible, feel their temporalis, all of that stuff. Then you want to check their lymph nodes, so that is going to be around the base of the head, up to the chin. You have the circle here, the circle of lymph nodes. Guys, I haven't revised for this video, so you know, I don't know what it's called, but I do check it for every patient. And then also down the neck, that's where the chain is as well, and you ask the patient to move their head and check their neck. Anyway, then you check for any asymmetry, and by that I mean anything abnormal. So everyone has asymmetrical faces. If you're looking at mine right now, it's asymmetrical. There's stuff going on here that's not the same on the other side. But you want to check if there's anything weird going on. So for example, when I open my mouth, does my jaw go to another side? Is there something weird on one side of my face, like a swelling that's not on the other side of my face? Stuff like that. And then you check the lips. So at rest, what are the lips like? So you ask the patient to close. Are they competent, incompetent? Other things about the lips. And the skeletal pattern. So ask the patient to look ahead and you just check their profile. So I think I'm a class 1. Yeah. Then you have the intraoral examination. Again, you mention everything that you've checked, even if there's nothing abnormal detected. So gingival phenotype, buccal mucosa, palate, pharyngeal arches, so that right at the back, tongue, flora mouth, etc. Then you check their static and dynamic occlusion. And it's really hard to do this on patients. It's hard to explain to them what the hell you're doing, why you're doing it, and get them to actually move their jaw in various places. But you mentioned this as well in your initial examination. It's something you should be doing in your initial examination. And then I'll just put a summary of a dentition, just so you know what teeth you're working with, what do you have here. And for pictures, just add in the sagittal image, so that is the side profile, and the transverse image, so that is just front facing. And it's just nice to show your examiners who you're what you're working with. Obviously you anonymize it by blanking out the eyes. So then you have the pre-treatment intraoral photograph. So you need to remember, these people weren't there when you were looking at your patient. They don't know what you know. So how are you going to show them? Yes, you're going to describe things to them, that's really important, but it's also really important to have visual aids. So photography, practice it on everyone like I said, and show people what you were working with. So anterior, left, right, maxillary, mandibular. So you want to show them all of that. So then you have your initial investigation. So yes, you've asked the patient what the problem is, but also they might not know what the problem is. They might have just come to you for a checkup and you look in their mouth and there are some problems there. So how do you talk about these problems? How do you record these problems? So you have a baseline dental chart that you have to do. When you see a patient, you check all of their teeth and you write down what's going on. So here I've put the dental chart. Remember to screenshot the chart in the beginning, because some software doesn't let you change a chart back to what it was before once you've changed it. So screenshot in the beginning after you've done your baseline chart, and then I would add a key, because not everyone has used the software that you use, so to show them what the chart means basically. Okay, then you have the BPE that you put over here, plaque and bleeding scores. So however you do it, put it into a percentage, I'd say, and then put it there. And then oral hygiene regime. That sounds weird when you say it loads of times. But yeah, so type of toothbrush, frequency, fluoride toothpaste, interdental cleaning, mouthwash. So I always ask the patient this after I've done the checkup and they're sitting up in the chair. I just ask them, so how's your oral hygiene? Like, what toothpaste are you using? What toothbrush? Blah, blah, blah. And then their dietary habits. So how many sugar attacks, acid attacks are they having a day? And you can determine this either by asking them questions or doing a 3-day diet diary. And then you do the risk assessment. Is their caries risk high, moderate or low? And that will depend on if they have caries. If they have high frequency of sugar in their diet, it's going to be high. If they're completely caries free, don't like sugar, don't have sugar, then they're going to be low. Then periodontal, so I would always go with, like, if they have a BP of 3 or 4, or they smoke or have medications that contribute to perio, or if their plaque and bleeding scores are really high, then they've got a high risk of periodontal disease. If they are like 0 BPEs, clean their teeth like religiously, they're really good, and then it's a low. Oral cancer risk, that would be from if you see anything abnormal, they have a history of cancer, if they smoke or drink, that is going to increase their oral cancer risk. And then occlusal risk, so when you check their static and dynamic occlusion, when you've checked their chart, if they've got chips in their teeth or tooth surface loss, or you realise they have these habits, parafunction, things like that, so then that makes them a high occlusal risk. I hope that makes sense. Next thing, so special investigations. I've basically described it all here anyway. So basically what the patient is telling you, now you've recorded your baseline investigation, like you've done all your initial investigations, so now what are you going to do about it? How are you going to confirm that there's a problem? And then how are you going to justify to the patient why you need to treat the problem? So I've put in some examples of the tests you can do, and then how you would justify these examples, and then you just also report what you found. If I'm taking radiographs, if the patient has a BP of 4, then according to the guidelines, according to the BSP, I'm going to be taking some periapical radiographs. And then you've got like sensibility testing, percussion testing, 3-day diet diary, 6-point pocket chart, working models, and I've got like examples over here. And you're not limited to just these tests. If you can think of more, you want to do more, you've got obviously a case that requires other special tests, then you just add them on here and you justify them and you put the results in. Then you go on to diagnosis and prognosis. So what have you found? What problems does the patient have? And then you want to go on to prognosis. So this is something I have added in a bit of detail on this slide. I'm not going to go through it, but you can have a read. And basically I made this up by myself. I used the tooth restorability index and then I kind of made the endo and perio one up by myself, because there's no real way to kind of guess the prognosis of a tooth. Everyone's going to have different opinions about it. At dental school they definitely had so many different opinions. I was always confused about prognosis of teeth. Read some papers and decide for yourself. This is mine. You guys can definitely change it around, but it works for me, so this is how I justify things to a patient. You want to go onto your treatment plan, and you split your treatment plan up into 4 phases. So number 1, your emergency phase, and this is something you don't have to have in every treatment plan. It depends on if the patient has an emergency. So for example, if they turned up with toothache and you had to treat that first, that's going to be your emergency phase. If they turned up for just a checkup and there's nothing urgent that you need to do, then you go straight onto your stabilization phase. So then you have your stabilization phase, and this is to do with prevention. So you want to stabilize the oral hygiene before you go on to do anything irreversible. So that means stabilize their oral hygiene, diet, any active disease that they have, so perio, caries, things like that. Then rehabilitation phase. So this phase involves restoring the function and aesthetics of the teeth. It's usually carried out only if the patient is dentally stable, so they don't have a high bleeding score anymore, they don't have a high plaque score anymore, their perio is under control, they don't have any active caries anymore. Now you want to go on and you want to address all of their aesthetic concerns or their functional concerns. For example, I've mentioned you wouldn't give a patient a fixed or removable appliance without making sure that their mouth is completely stable first. Then you've got your maintenance phase. So once you've completed all of the treatment, you want to maintain all of the work that you've done, and you want to maintain the patient's oral health, oral hygiene, and the diet, and the all of that stuff. So you want to give the patient an appropriate interval of when they should be coming to see you, and you just maintain everything, and everything goes smoothly, and they never need any work ever again. That obviously doesn't happen, but that's the aim. So after the treatment planning is when it gets a bit confusing. Now you want to talk about your specific treatment, and that's why I haven't put that much on these pages, because I don't know what your treatment is, I don't know your patient, so it depends, it varies for each patient. So what you want to do here is show your work. So you want to have screenshots of denture designs, you want to have graphs, you want to have like the progress of the patient, you want to have quotes of what you did, how you gave oral hygiene advice, or how you took a specific impression, what materials you used to do a crown prep, or impressions for a crown prep, what denture stages you went through, or how did you do your perio treatment, all of that. So recommendation is have a few slides to talk about all of this. I would split it up into the emergency phase. So for example, you have a radiograph, you can see the patient's tooth has got a periapical radiolucency, it's about to pop out, it's extruded, all of that. And then you talk about the special investigations you did and then how you treated that. Then stabilization phase, so how did you stabilize oral health? So the plaque score was 70%. How is it now gone down to 5%? Like, what did you do to do that? And how often did you monitor the plaque? What did you see in the diet diary? And then how did you tailor your advice to the patient? And then how did they end up improving their diet so much that now they are a low caries risk? Stuff like that. And then include in this photographs of the caries, photographs of the restorations that you do, periodontal treatment following the rationale of the BSP guidelines. So then you have your rehabilitation phase. You'll have a slide for this. So for example, you're about to make a patient a denture, so you've taken the primary impressions, you've got study cast, include your denture design, what did you have to think about in this stage? Why did you choose to do a cobalt chrome denture instead of an acrylic one? And then finally, your reflection. So as a dental professional, you are expected to continuously reflect and develop your skills. What went well in your case? So you could talk about how you managed to change the patient's attitude, you managed to do a restoration that was quite difficult, like a subgingival amalgam, and you chose the right material and it just turned out really great. What skills could you improve? My impressions were really bad at the beginning, and that caused the try-in to be not very good, and had to do a retry because I had to take impressions again. You know, what could you improve in that situation? Be specific. So like, I could have used another material, I could have done a bit more border molding. Next time maybe I could have done just a 3/4 crown rather than a full crown because that was indicated in this case, you know, stuff like that. And then what was challenging about this case? So you're gonna have a lot of things to say about this one. So what was challenging about this case? And you're gonna have a lot of things to say about what was challenging about cases. So I always get this thing for all of my cases. My challenge is occlusal analysis. Like, I'm really not good at analysing occlusion, and I always need a prompt from my supervisors. They always like, so what's the occlusion telling you? I'm like, I didn't really check it properly. I find it quite challenging, so that would be my thing. Was there anything that did not go to plan? So for example, you were mid-treatment and then the patient turned up, this actually happened to me. You were mid-treatment and the patient turned up with like a broken tooth, like completely broken. So you had to pause all of your treatment and focus on that and restore that tooth before you could go and do the rest of your stuff. So that's going to delay your treatment, it's going to delay the plan, it might mess it up. So yeah, just reflect on that. How will you apply what you have learned from this case into practice? Oh, that's how you do an occlusal analysis. Okay, and that's the significance of it. Oh, I don't want a non-working side interruption. Okay, so now I'm going to apply that onto all my other cases. So I'm going to make sure, before this case, I didn't really put any emphasis onto doing occlusal analysis because I didn't really understand why I have to do it. And now from this case I've learned it's so important because I messed up my occlusal analysis, I had a crown that was really high and the patient wasn't adjusting to it. You know, something like that. And now I'm going to apply this into practice. How do you feel about the overall treatment? So be really positive about this. Like, you want to show them that yes, you learned so much, there are things you would have done differently, but you feel really good about the overall treatment. You feel like you made the patient happy, you feel like you did everything you could, and it was just a nice experience. Was there anything you learned that you would share with your colleagues? So make occlusal analysis. I learned how to do it, how to check occlusion, or I learned that a full gold crown is really good for posterior teeth. I don't know, I'm just thinking of random things, like completely random things. That's the end of that. I hope you found this helpful. I know it's like a super long video. When I was making my case presentation in 5th year, this stuff took me hours and hours and hours because I literally just didn't understand it. I didn't know what was expected of me. This is quite like a basic presentation guide. Like, obviously you can add on way more stuff and make your presentations look amazing, include loads of more important things in your presentation, but this is just baseline. It's something I wish I had when I was in dental school, and this is what I use every month for my clinical case presentations. I use this kind of outline and it helps me just cover everything in my presentations, and it's something I think about when I see my patients, because I'm like, I need pre-op pictures, I need to check the BP, the BWE. That's something I didn't mention on there, but if your patient's got tooth surface loss, you want to check that stuff. I need to do all of these special investigations, like blah 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 blah. Anyway, that was a long video. I hope you found it useful. If you did, please subscribe to my channel. Please go check out thedentlife.com. I've got loads of other resources on there, including this one, so go download it if you want, and you can edit it however you want, include your own stuff. This is just a guide for you. I'm going to be posting a lot more videos this year, and I'm going to be posting a lot more videos this year, and I'm going to be putting out lots of blog posts and other resources that I like to use. So I hope you found this helpful, and I'll see you next time.